for joining us again for Making Sense of the Crisis from People's Assembly. Welcome to the fourth meeting in this series. We've looked at a general overview of the crisis. We've looked specifically at mental health. Last week, we looked at voices from frontline workers who are dealing with the crisis day in, day out. And tonight, it's a little bit of a different emphasis. We're going to be looking at truth, lies, and the mainstream media. Quite a dramatic title, but these are very exceptional circumstances. We're going to be looking at how we're accessing information at this time of lockdown for some people who haven't been out for weeks, for some people who are able to get out, how information is presented. We'll be thinking about whether the government briefings are an attempt to kind of take control of the agenda and manipulate how the crisis is seen, and much, much more. And of course, we will be taking comments from you. The People's Assembly is really hopeful that everyone is well as they can possibly be. As always, please share this event. That's how we get this live to the largest possible audience. We want people who aren't traditionally interested in political events or overly political shows to watch this, to think differently about this crisis. Why don't you tag somebody in the comments, somebody that you might have commonly have differences of opinion with, who might see this crisis in a very, very different way. You tag them in the comments and see if they are open to watching this. I don't know about you, but I've had some real kind of political lows this week. I've seen some real political lows, not least the Badgegate. I don't know if you know what I'm talking about, but the moment where our health secretary said that care workers were going to be valued the same as other health workers, and that they were launching this badge that said care on it. And I might be wrong, but from what I can see, it turns out that this badge was already in production, that it's currently unavailable on the website, and then it costs more. So you actually have to buy these badges, by the way, costs more than care workers typically earn in an hour. You just couldn't make it up. And this is what this show is about tonight, really. Surely that is a method of distracting people's attention from the catastrophic impact the virus has had within the care sector, the lack of PPE, the lack of testing, the exposure to the virus, the extremely vulnerable positions these care workers are being placed in, and then of course the patients too, those that they're caring for too. And most of these people are on the minimum rate of pay, and we know that the minimum hourly rate of pay doesn't actually afford somebody enough monthly income to live, to not get into debt. So value an association with a gimmick like a badge just was a real low. I have to say as well, I was also very disappointed with the leader of the opposition stance, with the Labour Party's stance on their priorities. I know that they have today welcomed the extension of the lockdown, but if you look at some of the demands that were put out today, so they wanted the government to tell us how it would decide how and when the lockdown would ease, publish an exit strategy, and let us know which workers and industries will be able to return first. And it kind of contradicts some of the World Health Organization's conditions to exit this lockdown, because they're saying you have to make sure disease transmission is under control, that health systems are able to detect, test, isolate and treat every single case and trace every contact. The education levels within communities are really, really high about how it's transmitted, about how to keep themselves safe. It just seems like a very, very weak response to this crisis and to the government, because the last point, let us know which workers and industries will be able to return first. Well, I know that there are huge sectors of our economy that are still at work, and they are still being exposed to the virus, and they are taking part in non-essential work too, and they are crying out for state intervention to say, publish a list of all of those jobs, all of that work that should be shut down, because we are not able to distance from our colleagues in a factory, or when we're delivering things to people, we're not able to implement those. We don't have PPE. It seems really out of touch, essentially. And I'm sure many people watching this support an extension to the lockdown. We haven't got the tests that we need. We haven't got this virus under control. The health service is under stress. This is what we're going to be talking about tonight. But we must be calling on the government too, because some of the earliest data shows that those people who are in those huge workplaces, precarious contracts, poor relations with their employer are most exposed to this virus. And we want them, and them being the government, to shut down that non-essential industry. Tonight we've got three excellent guests to talk us through how they are making sense of this crisis. And as always, we'll come to your questions. We've got Aaron Bastani, we've got Aislinn McLean-Doherty, Gary Young too. And I'm just going to ask them before I introduce them properly. What is the weirdest thing for you during lockdown? I'll start with you, Aaron. What is the weirdest thing about this process for you?
That's a really tough question, because I think, I mean, it could be a panoply of things. I think the idea of a state-sanctioned walk is probably pretty high up there. I think the weirdest thing, actually, the one I wasn't suspecting, was the degree of consent that people would have to such huge constraints placed upon them. And I think actually the consent to that is far greater than the government probably foresaw or expected. And it goes to show, and it's a pleasant surprise, it goes to show that people are naturally cooperative. People naturally want to work together for the greater good. And that really takes to task the fundamental myth of how our politics has been guided for the last 4 decades.
Absolutely right. Aislinn, what's the weirdest thing for you about this?
Probably learning how to cut my husband's hair. That doesn't look like really weird, like a hash job. But also, I think in the NHS, it's not weird to me because I knew that we had it in us, but the ability to see massive flexibility, an enormous kind of sense of courage and motivation and willingness of people to step up and take on roles that they never have done before, but seeing it at such scale. And also what I'm finding really weird as an oncologist is how much I think there is going to be certain repercussions further down the line for how much of the care we're now delaying, or, you know, people that we're not treating. And it's beyond weird, actually. I feel deeply uncomfortable with that. So waiting to see what the fallout will be for months and years to come. I'm a bit worried about that.
And you, Gary?
One of the weirdest things has been the degree to which some of this has reminded me, I lived in the Soviet Union for 6 months, and I was having this conversation with this woman in the line in Sainsbury's about where she might get spaghetti, and that started a kind of broader conversation about what she was going through and what I was going through, and I was trying to describe to her this shop where I got spaghetti. This is in Hackney, and those were exactly the kind of conversations that you would have. It was towards the end of Gorbachev's time, about like, really, you found eggs? Where did you find eggs? And you would always kind of go out with a little bag just in case you found something. And the other one is listening in to my daughter's FaceTime calls with her friend. My daughter is 7, and they don't go to the kind of like, how are you space? What are you up to? They go straight into emojis and just weird kind of stuff about shows they've watched, and it gets very, very weird very, very quickly. And I guess all of that would take place in a playground usually, but you know, I've never there.
So strange. My partner said the other night something like, I wonder if you're a shielder and you went out for a walk, if you get a fine from the police. And I just said, imagine if you in November were given that sentence and, you know, told to try and think of what context that sentence would be a realistic situation. And I think all three of you have kind of touched on how quickly we've adapted to this new reality, no matter how painful it has been. We're all in this place now together. Some, of course, have very different experiences to other. And I'm going to come to you first, Aaron, for your kind of take on how you're making sense of this crisis. You are one of the founding members of Novara Media. That's right, isn't it? And you are also an author. So we're really, really pleased that you've come to this People's Assembly broadcast tonight. Thanks so much, and over to you.
Yeah, I'm just going to ask a quick question. Can people see my video when I talk?
Yes.
Good. Because I've not, you know what, I'm as much as we try to be sort of technophiles at Novara, I don't use Zoom. We use StreamYard.
Oh.
So yeah, no. So that's good that you can see me.
We can see you. Yeah.
Good. I suppose I want to I can talk, what, 5 minutes? Yeah. I want to, I guess, start by saying a few of the things that you've said, Laura. The first is, I think that we've seen real weakness of political leadership on this from the Labour Party. Now, I'm not saying that to put the boot into Keir Starmer. I'm not trying to portray him as a right-wing politician. If Keir Starmer left tomorrow for whatever reason, we'd probably get a leader further to the right on the Labour Party, or somebody of the same political complexion. But I think how he's handling this is very, very poor, and I'll tell you why. I think the framing of an exit strategy, I think in itself is problematic. Exit strategy historically has been used for foreign interventions. You go in, you make a mistake, you leave. This is not like that. This is a problem. Flu and cold season, I'm not a doctor, we have other esteemed guests who can say this far more articulately than I can. Flu and cold season is going to become flu, cold, and COVID-19 season. And people need to accept that. And they need to accept that until there is a vaccine, at the very least, could be 12 to 18 months, we're going to see significant changes to how we run society and our economy. We will see, for instance, major changes, I hope, in terms of who can enter the country, how easily, with what documentation. I don't like saying that. I believe in relatively, ease of travel, but that's clearly something we're going to have to do, not just as one country, but as a global society. Clearly, we're going to have to massively expand healthcare provision, healthcare infrastructure, particularly for the elderly, particularly for the vulnerable, a greater capacity for home caring and so on. Clearly, given we're going to see a massive increase in demand, we need to better pay and reward healthcare workers, particularly those in social care. We ideally would expand that part of the labour force significantly, but sadly we can't because it's massively underfunded and it's massively understaffed as it is. So I think the focus on an exit strategy is just errant in so many ways, because A, we can't just exit this. It's here for at least a couple of years. And B, it neglects to talk about the fundamental political issues that actually coronavirus brings to the fore. And I would say that the government's response so far has been twofold. There's been the public health response, and there's been the economic response. Actually, the economic response has been okay. It could have been a lot worse. You've had 80% of workers' salaries up to a certain amount being looked after with the furloughing scheme. Although it should be topped up by most employers, it's not being. The Guardian's one exception, but so some people are coming out of this okay. You're seeing credit extended to businesses who may be struggling. You're seeing significant help, a package of help to small business and to workers and to the self-employed. Not as comprehensive as it should be, but I'm surprised. I'm surprised the Tories would run a 14% deficit to help small business and working people. Where it's been catastrophic is on the public health side. It has been utterly catastrophic. Now, people say, did we ever have a herd immunity response? We still do. In the absence of a proper track and trace response with mass testing, a real emphasis on PPE, and a real emphasis on building up healthcare infrastructure, we have, by default, herd immunity. We're just not doing it as the same extent the government would like us to have been doing it, probably until March 12th, 13th. That's when they realized it wasn't tenable as a way of dealing with this. Now, let's establish a quick timeline. Nobody on earth, and this is another reason why I have a problem with the exit strategy frame, nobody on earth knew this virus was transmissible from a human to a human until, at the earliest, December. But from what we know, January. Okay, so it's not till early this year. So if virologists are unaware of the extent to which one has immunity after one has been subject to it, So much is hearsay. You see economists say, well, I don't want to say too much because I might be proven to be an idiot. Well, that happens all the time in economics. The worrying thing is virologists are saying that in regard to COVID-19. So if virologists don't want to say anything definitive right now, I would submit that politicians certainly shouldn't be doing that. We know about the science basically from January 24th. That's when we get a paper in the Lancet. 6 Chinese scientists basically confirm about incubation periods, transmission rates, the extent to which people are going into ICU, comorbidity factors, etc. We know the scale of the problem then. The British government says, at some point, this is Chris Whitty, around the same time, 24th, 25th of January, we may at some point have cases in this country, but we're prepared for them at some point, right? 7 days later, we have the first 2 cases in this country, 2 Chinese students in Yorkshire, 2 students of Chinese heritage in Yorkshire. Still, we're well prepared. Now, it's interesting. I don't recall really seeing that story on January 31st, because you know what else was happening then? We were leaving the European Union. We had an entire political class asleep at the wheel because of this huge political event. And yes, it's an immense political event, but they took their eye off the ball when it mattered the most. Even then, for the whole of February, we could have prepared, we could have purchased and procured PPE. We could have taken measures in terms of border control, border enforcement, which would have been advantageous. We could have given out a great deal of advice to minimize and mitigate what we're presently going through. We chose not to. Why? Well, that wasn't a failure of imagination or to foresee the scale of the problem. It was because there was a political strategy of dealing with this, which effectively was analogous to walking towards the fire. How are you going to become fire resistant? By walking towards it. Now, that works to some extent. You know, you get used to a certain level of heat. If you walk too close, you burn yourself. And that's kind of what's happened. And if you look at government kind of interventions on this, Chris Whitty spoke to BBC Radio 4 Today programme, Sky News. Around the 12th to 13th, they were still saying this is a herd immunity strategy. At the same time, we were seeing testing for non-urgent cases scrapped. Just at the very moment we should have been massively expanding testing capacity, which is what they did in South Korea, in Norway, and Germany, all the places which have actually come out of this very well. So the healthcare response has been appalling. Multiple times in February, when we had about a 5-week window to really respond to this, we could have been like Norway here. We could have been like Germany. We still don't know how bad it's going to be. On a per capita basis, we could end up being the 2nd worst affected country in the world, maybe even the 1st, according to one study. But throughout that period, Matt Hancock, Public Health England, Chris Whitty, government advisors all said 2 things. We are prepared to deal with this, and there is no major threat to the British public. That changes late February, early March. We don't get a government strategy on the coronavirus, in their own words, until March the 3rd, I believe. And around the same time, you still have Boris Johnson going on daytime television saying how he shakes people's hands, right? It was a joke. Of course, a few days later, you get the stuff about Operation Last Gasp. Look, I'm very happy he's well and he survived, but there is clearly a level of hypocrisy in the media coverage around his case, which fortunately he came through, when they failed to mention this. And I suppose I'll finish with the media response. On top of all this, I've already pre-spoken for my allotted period. It'd be I don't know, half a minute. The media response for me has been abysmal. But it's not been abysmal because it's failed to inform the public. That often happens with the media in this country. It's because it has actively sought to cover a government strategy of herd immunity, which at a certain point was clearly not going to have political consent, democratic consent of the country. And they sought to continue to give them cover for weeks after that. People didn't know the scale of this problem, I would argue, till early April, in terms of the real tragedy of the numbers involved. And the media is partly responsible for that. They could have done a better job there. And what I find most concerning of all is that when 1,000 people are dying every day in Italy, it's a tragedy, it's a trauma. Or when an Iranian politician has it, it's ridiculous. It's symptomatic of a regime unable to govern properly. Yet when precisely the same things happen in this country, we are told to perform a certain affect. We're told that actually 1,000 deaths isn't so bad. Actually, 20,000 deaths, we were told not so long ago, that would actually be an achievement. 3 weeks after being told by the relevant authorities that we had nothing really to be concerned about and we were prepared. The absence of accountability and scrutiny here from the authorities, from the government, from the scientific advisors is horrendous. And I think it shows us as a society in Britain, how poorly are we equipped to deal with the problems of the 21st century if we have such an incurious media.
Very, very well said, Aaron. Thank you so much. You actually stuck within time, so you don't need to worry at all. Very succinct. And there's so many points I want to kind of pick you up on, but I'm not going to disrupt the flow. I'm going to come straight to Aislinn Macklin Doherty. You're an oncology registrar and NHS campaigner. You're a member of Keep Our NHS Public and Health Campaigns Together. Over to you.
Thanks, Laura, and thanks, Aaron. I think you've perfectly illustrated and walked us through the timeline that has led us to what can only be described in healthcare terms, public healthcare terms, as a catastrophe, to be honest. And people like myself we've got front row seats to the fallout of that at the moment. So I look after oncology patients, arguably amongst the highest risk cohort of people in this country, patients being treated with chemotherapy with very limited immune system. And about a month ago now, it struck me. I was sitting in an oncology clinic. It was St. Patrick's Day because I'm from an Irish family, so I remember the day very well. And you've just highlighted how far along the line we were already in terms of our knowledge and knowing how this virus was picking up speed in other countries that had been declared a pandemic. And I was sitting in an oncology clinic waiting to see several of the most vulnerable people in a patient population with nothing, with no guidance, with no protection, with no access to testing at that point, despite the WHO's, the advice of test, isolate, protect, treat. And as a group, we were sitting there absolutely gobsmacked. We'd read the data coming out of China, out of Italy. We had shared the experience of our colleagues. We knew this was highly infectious. We knew it had a high mortality rate, and yet we were sitting there with nothing, about to see very vulnerable patients. We didn't accept it. We made a lot of noise in our trust. We took action immediately ourselves, despite there being no government guidance. Delayed some consultations, changed them to face-to-face appointments, adapted quickly, didn't examine where it was necessary, based on the knowledge that had been shared. And it was very, very clear to all of us how woefully and actually quite dangerous the government's response and how inadequate it had been. But we were able to be flexible and take on the responsibility of being able to look after patients. Now, that was absolutely vindicated, that concern. 5 days later, I tested positive for coronavirus. I'm extremely lucky. I had a very mild case, but I cannot describe to you the guilt that you feel not knowing how many patients that you have put at risk because you were not provided with the equipment, the necessary testing, the resources to be able to protect them, the very people that it is your job to care for. I can't quite describe the level of anger, guilt, frustration that I know many of my colleagues share. Now, I'm in a very lucky position. I know I was positive. I'm also in the position to know that is absolutely not the case across the country. We've got surveys 2 weeks ago that 87% of staff had no access to swabs. Even this week, over half of doctors feel like they are entering high-risk procedures without the appropriate protective equipment. I am lucky, but my colleagues aren't. We now have health workers dying on the front line because they don't have access to the necessary tools, the necessary tests to be able to isolate themselves, protect themselves, and to protect patients. And it's a woeful indictment of the response of this government. I think the numbers actually tell the best story, because they tell you what the government has done, but also critically what it hasn't done compared to other nations. We know we are woefully inadequate in terms of testing. We've tested about 300,000 compared to Germany's 2 million nearly. We are of a comparable, nation of comparable wealth, comparable GDP. It's a scandal that we are not testing at least frontline NHS staff exposed regularly, who are now paying the ultimate price by putting their lives on the line. And what has become very apparent to me, and I think this will be the recurring theme coming out of this pandemic, is it's a story of disparity on many levels. It has really accentuated deep inequalities and discrepancies in how our government values different sections of society. But the key disparity that I've noticed is what we are told is happening and what the reality is. We are still even now being told, I'll switch on my TV tonight and guaranteed there will be a minister behind a podium telling me that everything's okay, telling me that I have the necessary gowns, telling me that I have the necessary equipment. It just ain't true. And thousands of my colleagues up and down the country will attest to that. They say they're delivering hundreds of millions of protective equipment. I don't know where to, because we're not getting them. So there is a discrepancy there with what we're being told and the reality on the front line. There's also a massive disparity in now what we are able to deliver in the NHS, unfortunately, on a national scale. And it's taken this crisis to really highlight what many of us have been saying now for many years. Because of the economic austerity policies that have been implemented, because of the political decisions made to outsource and sell off large parts of NHS services, land, staff, we now have an extremely fragmented service that it's very difficult then to get them to step up in a unified, coherent way. What is actually happening is you've got hundreds of different trusts, ring-fenced budgets, operating independently, who are each able to respond very differently. So me sitting in a London, heavily invested, quite wealthy, affluent hospital, I am getting a very, very different level of protection to the NHS workers up in the north of the country, or right down in the south, or more rural areas. So there's a real disparity in terms of what we're being able to provide across the NHS, largely as a result of the political choices that have been made in the last few years. And what's also really upsetting is the disparity in, I suspect, that will play out in patient outcomes. I think we're going to see pockets of the highest rates of deaths in the places where they're not able to get access to the ITU care, they're not able to get access to the non-invasive ventilation or the ventilators. There aren't enough hospital beds because we've closed 17,000 since 2010 and counting, because there aren't enough doctors because half of them are off sick, and they've chased many thousands of us away by undermining our terms and conditions over the years. Not to mention staff, nursing staff, and how terribly many of them feel they have been treated. So I think that's going to play out with disparity of outcomes and pockets of death, likely in the poorest parts of the country. But lastly, and I think this is a disparity that actually could lead to a way forward and actually presents to me a bit of hope, is the disparity between what we were told was politically possible even 3 months ago and the reality of what is actually happening now and what we can see politicians are able to do when push comes to shove. We had a general election campaign where Labour, campaigned on the basis of creating a massive investment programme in public services, in key workers, in education, and it was ridiculed and mocked as extreme and not realistic. That's happening now. It is happening now. And what's very, very clear to see is who the real key workers, who the real people that provide value and productivity to society really are. Richard Branson hasn't given up any of his yachts, as far as I'm aware, to create ventilators. I haven't seen Sir Philip Green come in and delve into his pockets to provide PPEs or, you know, masks. They keep hold of their profit. They are in fact in line asking for handouts from the government. Meanwhile, the key workers risk their lives to carry people through the crisis. So what I'm hoping is at the end of this, the people that have carried on and will get us through this, the teachers, my colleagues, nursing staff, porters, cleaners, have the confidence, and it's now backed up by the evidence, that there is a political and economic alternative, and that they should demand to be valued better, and society needs to be structured in a way that it values their input.
Thank you so much, Aislinn. I couldn't agree more with everything that you have said. I think it is quite hard and wonderful in the same breath with people who are donating, they're fundraising, you know, some incredible efforts that are going on at the moment. But you're right, I'm not seeing very many billionaires who are forthcoming with, you know, a proportionate amount of their wealth to get us out of this crisis.
They're asking for handouts.
Yeah, or questions too, that why were they able to have so much wealth in the first place? Some from these kind of, I'm not suggesting people with care companies are billionaires, but some with huge levels of wealth running care companies with workers on the minimum wage. It highlights the deep inequality, as you quite rightly said, in our system. Share this, please. If you've not done it by now, why not? Why haven't you shared this? What excellent contributions that we have had so far, and that will come. And if you share it, it doesn't matter if it's, you know, we're halfway through now or a little bit over halfway through now, because people will be able to watch it after it's done too. And people are going to want to hear Gary Young. He is a writer and a journalist, and it's my pleasure to introduce you to your 7 to 10 minutes. Gary, take it away, please.
Thanks, Laura. I mean, this reminds me quite a lot. This moment reminds me of when I was covering Hurricane Katrina for The Guardian. And what you saw was this momentary crisis, a hurricane that didn't actually even land in New Orleans. It landed in Mississippi, but that washed up these underlying tensions and inequalities, and really following on from what Aislinn was saying there, that kind of laid bare what had been there the whole time, including a depleted infrastructure, the underinvestment in the levees and all that kind of stuff, which could have prevented an awful lot of what happened. You can't stop the hurricane, but with a public response, with public funds, with a public mentality, with a collective mentality, you could have protected more people. And the way that the media responded in that moment was a moment of discovery. Look at this poverty, look at this racism. How could this happen when it had actually been happening the whole time? There was an amazing quote from the head of FEMA at the time, Mike Brown, who was appointed because he was a friend of Bush's friend or something, who said, when he was asked why they didn't have anybody at Superdome, he said, "We're seeing people now that we didn't know existed." And there is something about that in this crisis, in this moment, that it is, COVID is the last crisis for some people, literally, on top of a series of crises that they have been experiencing over the last 10 years, crisis in housing, crisis in health, crisis in work, and instability. And there is that phrase in journalism, I certainly learned it at journalism school, you know, when a dog bites a person, that's not news. But when a person bites a dog, that's news. And the notion there is that, well, there are things that you get used to. There are things that cease to be news as such because we're all aware of them. And sooner or later, you have to ask yourself, well, who owns these dogs? And why do the same people keep getting bitten? And what can we do to rein in these dogs? Because what this virus is showing, both here and in the States, is it's massively, disproportionately affecting people who are poor, people who are Black, people who are centered in certain sectors, who tend to be either poor or Black, and that's not by accident. There has been, I've seen it on social media, this tension about like coronavirus doesn't discriminate, coronavirus does discriminate. Well, of course the virus doesn't discriminate. It's a virus. It doesn't care whose lungs it infects, but society discriminates. And then on the basis of that discrimination, then the virus takes a certain kind of person out. And so we have long been living in a state of crisis. This is one more, and it is exceptionally lethal. And so, of course, if you live in a council block, or if you live in a block of flats, or there's X number of you to a room, or you are in the gig economy, of course it's going to be harder for you to self-isolate. It's not even a paradox, it's a hypocrisy, is the degree to which our NHS would be useless, always would have been useless, without immigrants. My mother came from Barbados to work in the NHS as a nurse. A number of Irish people who came to work in the NHS, a number of people from Asia and the rest of Europe. And so we have, on the one hand, these people who are saving our lives, who are heroes. Every Thursday night we'll be out clapping them. And yet we have a political culture that condemns them. They're the people that are keeping us alive. Not the only people, obviously, but the NHS couldn't survive without them, and could never have survived without them. I mean, it is a coincidence, but it was a timely one, that Windrush landed in the same year that the NHS was created. This is an institution more popular, makes people more proud to be British than the Queen. And the people that keep it running are reviled in our political culture, not by everyone, but by enough people. And so then you get to this issue of the media and these dogs, and the fact that this has been going on, not just this with COVID, but the inequalities that it has laid bare, we have seen for at least a decade since the Tories first came in, and some of it before under the Labour government that privatised bits of the NHS and so on, and that that the media mocked the attempt to create some kind of opposition to these things. They didn't kind of you couldn't find a columnist who wanted an opposition that would address these kind of deep-seated problems. When it arose, they were dismissed. And so we have this situation with this government, which I don't think is being held accountable, and I don't think is being held responsible. And then, almost going back to I described earlier, kind of some comparisons to the Soviet Union, these press briefings, where they come out and they tell you what the government is thinking this day, and it's a difficult thing to report because of social distancing and so on, but it doesn't seem to bear, as Aisling was saying, any kind of relation to what is actually happening on the ground. And so we have the situation where we go out and we cheer for these people who we are sending into incredibly dangerous circumstances without the right equipment. It's like coming out and cheering your troops as they go to battle, and they haven't got any guns. And I know that the war metaphor, we don't want to overlay that, but like the degree to which the media's job here is to hold the government's feet to the fire, not to say, oh, isn't that lovely? Boris has come out of of hospital, but that this is a leader who openly mocked the things that would have prevented him going into hospital, that you wouldn't wish it on anybody, of course. And yet him being in hospital, praying for the best, was an embodiment of this government's policy, actually, of its strategy. It was like, well, here we are. And so this notion that we're all in it together, which, because of those inequalities that I mentioned before, we are clearly not all in it together. One gets a sense when you survey the press in general that there is a group of people who are all in it together. And it's not, I don't feel like I'm part of them. I'm no longer a journalist, but I don't feel like, I feel like they kind of constitute a strata, the political establishment, the media establishment. And it feels like pretty much every evening they ask the same questions. And they are, when will there be this? And then the ministers, we're doing our best. And it's like, but nothing is happening. And, when will there be this? So I feel that role that the media should have, the role that the media is really is burdened with, if you like, it's not doing it. And one of the reasons it's not doing it, I think, is it speaks to the kind of nature of the last 10 years, and in some sense, the nature of the kind of last 4 or 5 years, that kind of what this last crisis needs, what it lays bare is an urgent need for fundamental, thoroughgoing political and economic change. And the media has already made it very clear that it's not down for that.
Thank you so much, Gary. They have made that very clear, and it became clear in the general election when kind of poverty statistics or cut statistics started to be refuted by some journalists saying that's not true, or kind of dancing around the issue of what poverty actually really meant. And when you talked about food bank usage, the classic adage, well, if you put free food in front of someone, they'll take it. A real right-wing kind of myth. Somebody has quite rightly pointed out, and it's a bit uncomfortable, isn't it, for people on the left, but Karen's asked, why do you think someone like Piers Morgan is so strongly criticising the government? I've seen left-wing people who I never would have thought would share Piers Morgan because of his past, because of some of the things that he's said about left-wing people, or the treatment, his kind of aggressive interviewing style. What are your thoughts on that? Why do you think there's this real pressure coming from him?
Do you want me to respond, or?
Yeah, Aaron, go for it. Anyone, just this is open now.
Yeah, I don't think Piers Morgan's not an ideologue. Piers Morgan is, this gentleman. His first job in journalism, maybe Gary can correct me, was I think at the Bazaar column at the Sun. He then stays at the Sun. He moves to News of the World. The man is a populist, not necessarily in a bad sense of the word. He can be in touch actually with a certain pulse of public opinion, which more elevated and esteemed journalists might not necessarily detect. And he's happy to get people's backs up, often actually to his own detriment, as we saw with the faked photos of torture in Iraq by British soldiers in the early 2000s. Although it must be said that was happening. It just wasn't in the photos that were on the front page of the Daily Mirror when he was editing it. So I think it's because he recognizes there's a problem here, and fundamentally he has no real ideological commitment to the status quo. I mean, he's done very well out of it, but he's not. I don't view him as a partisan figure necessarily. I think he obviously has political commitments, but he's not somebody I would look at, for better or worse, like a Robert Peston or some people who are more immersed in the sort of political media classes, as Gary very wisely puts it. I think Piers Morgan's in that, but he's slightly autonomous from it as well.
It's also true, Laura, that it's an open goal. I mean, like, that doesn't detract from what he's done at all, but I mean, the questions he's asking, and I'm glad that he's asking them, they're not brain surgeon questions, right? No insult to brain surgeons. They are the questions that journalists should be asking. And so so there's a real gap in the market.
So why do you think that the other journalists, because I want my own thoughts, but why do you think the other journalists are not asking this? Gary quite rightly said, every day we hear these questions, they're quite timid. It does not seem proportionate with the level of deaths that are out there, the level of people that are being sent into very vulnerable situations, including those people who are saving lives, and they're so timid. Where is that coming from?
Well, I guess Gary's better placed to answer this sort of within historical context, but the adversarial nature of journalism just seems to have completely disappeared. And I think it's disappeared really over the last 20 years. It's quite new. But even 10 years ago, as I was a student at university or whatever, I remember I'd read The Guardian and you'd get some really interesting out there articles on foreign policy. And I don't mean out there as in odd. I just mean, they had a line on things and that's fine. You have an editorial team. But you'd often have people dissenting with that quite dramatically. That doesn't really happen anymore. That kind of adversarial, truth-seeking, you see it more in the States. Not to say American media is perfect, but you certainly see more of this. I think partly because we have London. Everything happens in London in this country, particularly with regards to media and politics, and particularly because of the nature of how the British establishment reproduced itself, the public school system, Oxbridge. They all know each other. And I think a counterweight to that for a very long time, one was the Labour movement. Another after the 70s was very strong anti-racist movements. In the last 20 years, those have kind of died down a bit. And so, more than 20 years, but you know what I mean, in terms of how that came through into the press in particular. So I think it's part of a sort of more general malaise. Look at the coverage of the second Iraq War, exactly the same problems.
Ashkan, what do you think? Because I remember being in Parliament and kind of holding up reports about food bank usage or cuts in the NHS, and there just being this mantra, there's never been more money, and journalists wouldn't kind of challenge that in a strong way. Why do you think this system is exactly the same in a crisis?
to be honest, I don't know, and I'd really like to know the answer, because I cannot tell you the numbers of interviews and been on the BBC, ITV, Channel 4. I've spoken to so many journalists, and I'm very sorry to say that I've had a very consistent experience of censorship and editing, whereby I'm prepped, I'm asked what my views are. If they don't fit with the narrative, you don't make the cut. If you're going to say anything by that narrative, the time on you will be limited. For example, I've even written articles in mainstream press, the Guardian one, where political points that I think are very important about NHS cuts, privatisation of services have been edited out before publication. So I've had quite extensive experience, and it's taken me personally experiencing that to realise the extent of it. I don't know. I wonder, there is a certain element of self-censorship that I feel has emerged amongst doctors. We're a professional class of people, and we have broadly been educated within this certain framework in the last 10, 15 years. There hasn't been really a political alternative narrative. And I just wonder if the media is now made up, its ranks largely of similar professional class people who truly believe their narrative, and therefore anyone that is speaking outside or challenging that, they self-censor that. And so they don't even think to ask those questions. That's the only kind of thing that I can think of is happening.
I don't know if you want to come in, Gary, before we move on to another question.
I want to say, first of all, that there are lots of journalists out there who are doing their best, doing good work, and also that this is not an easy thing to cover. because of social distancing, access to hospitals, and all of that kind of stuff. It really is a difficult thing to cover. But you can't say that without also looking at, you're more likely to have gone to Oxford and Cambridge if you are a columnist in the British press than if you're in the House of Lords. So you're talking about a very fetid ecosystem here of people who kind of know each other and are like each other, and it draws from the same, they do draw from the same social pool. And so the kind of the parameters, and there's nobody who ever, you know what, there probably are in lots of places, but generally speaking, nobody has to tell you what is or isn't kind of permissible in a certain ideological space. You know, you're aware of the borders, and you're aware of what happens if you transgress the borders. That this is this is a Mail article, this is a Telegraph article, or whatever. And so the framework for what is possible is never dictated and never fixed, but it's always there. And you have something like this where you have to move out of the framework. We've never been here before, and people are scared. They're scared to kind of to go it alone, to say what they think, to kind of it's their job, but they're scared. And I do understand that, and I do also just think, well, just if you just do your job, you'll be fine. And if you're not fine, actually, many other people will be in a much worse place than you.
Ben Chatko, the editor of the Morning Star, in a statement that is now on the comments, talked about the biggest silence is over what the crisis tells us about what is wrong with our society, like the fact that 11 million workers who face destitution because they fall through the gaps in government support schemes as their agency workers on 0-hour contracts or bogus self-employed, or earn so little that they don't qualify for sick pay. As we come through this crisis, we have to consider why Britain looks set to be the worst hit in Europe, and that's down to a cutthroat capitalism that milks our public services for profit instead of a media clamouring for ministers to explain things and when they'll go back to normal. We need a media that exposes why things have to change forever. I think it's a very poignant point. Another point is exposure to the cruelty of the system. I know a couple who for the first time are exposed to the universal credit system. There's been 1 million people placed on it, and we're like, oh, I kind of see why you were banging on about the universal credit, because it's awful, it's so slow, I don't really understand the system. Another person, Isabel, and I suppose this will be our final round, if you like. We always stop this programme just before the applause for the NHS and other key workers. But she talks about, what can we actually do when we're all locked down? Sorry, it was another Karen who said, how do we do something to protest what's happening right now, re the government failures? Because that is, we can't meet, we can't all mass gather to show expressions of resistance to the government or our discontent. What can we do? I'm happy for anyone to come in. Go on, Aaron, go first. Yeah.
I'll try and be quick. It's a super question, and obviously it has so many dimensions, because there are people with misgivings about all kinds of things related to this crisis, but also not related to the crisis. Like politics, as we know, it's on hold. Because you can't do that face-to-face meeting. What I'd say is the first thing is get involved in mutual aid. Get involved in local efforts to coordinate helping people who are perhaps marginalised or isolated. If there is an effort like that, get involved with it. If there isn't, maybe try and start one. What we did here, my partner was putting through a letter through all the letterboxes on this street. I'm so-and-so at this address with this phone number. If you need anything, etc., deliveries or deliver the post or whatever, I can help you. Get in touch. I think that's the first thing you can do, is reach out and help people on a human basis. But then I think the second thing is to think, and you're absolutely right, how do you coordinate with other people in terms of preparing for what comes next? And it's an intriguing question. And I think, I don't think it's as bad as perhaps we might have thought. And I think people are pivoting to forms of online conversation and collaboration far more than might have been predicted. I mean, this Zoom call is one example of that. And so I think for people who care about social justice, equality, I consider myself a democratic socialist. How do we use these technologies, which afford us so much more capacity to organize than before, to ensure that, in the next 2, 3, 4 months, we can make the argument as strongly as possible? And I don't think that trade unionism or being a member of a political party has to necessarily go on hold. I just think we have to be a bit more imaginative.
Gary?
Yeah, I think on top of all that, not wanting to duplicate what Aaron said, we can think and we can share that we are in an unprecedented situation, and actually asking the right questions, and that is one of them, is the beginning to us then kind of working out, well, what is the situation? Who can we help? What is, not to contradict what Aaron was saying previously, but what is our exit strategy, if you like? That there isn't going to be, that the old normal's gone and it's not coming back. What do we want to keep? What do we not want to keep? And actually framing our response. And that's something that we can do together. It's something that we're doing now.
The last minute is over to you, Aislinn. What can we do together in this situation?
Analyze, think, share thoughts, shape the society we want. And that is not limited by us not being able to meet. I think an enormous vacuum that has been part of the left for many years, until I think the leadership of the left and Corbyn was part of that, was a lack of vision about where we were going. I think whilst everything is kind of almost holding still at the moment, what we should be doing is talking to each other, creating the ideas and the analysis necessary for what we want society to be like, what economic changes we want, what political changes we want, what structural changes we want, and a path to how we make that happen at the end of this.
Thank you so much. And I think that what has been clear from your contributions in such a short time is that it is up to us to shape our own consciousness. It's not going to come from, the daily briefings from the government. The truth will always come from people writing about it, sharing it, from our collectivism, essentially, making sure that we put the pressure on the government. I think government policy was changed and is changing throughout this process because of public pressure. And we're going to end now by saying we are back next week for making sense of the crisis. We're going to be thinking about what an alternative system could look like. We're going to be joined by some absolutely brilliant guests, and we're going to go now and join in with the applause for the NHS and key workers. And then I'll remind you of the chant. This is where it gets a bit cringe. Test, 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 PPE, keep our key workers virus free. If you want to bring a bit of politics to the chant as well. I know that call came from many of the NHS workers, staff, key workers, care workers, that the applause is beautiful and brilliant, but there are structural, as has been very eloquently outlined today by Aislinn, there are structural problems that they need protection, and we need to stand in solidarity with their demands too. So test, 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 PPE, keep our key workers virus free. Thank you so much to Aaron, Gary, and to Aislinn, and I'll see you all next week.
Thanks, Laura.
Are we done?
Presume so.
See you later. Stay safe, Aislinn.
And you. Thanks,
Bye.
Aaron.
Bye.
Bye-bye.